Hello everyone, this is a video about the GI map test. Just before I jump into the video, if you don't mind taking a quick moment to please either like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying on this video should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I've talked about the GI map test in videos in the past, but I was just one of my somebody emailed me about, or one of my patients emailed me about this video, or emailed me about the topic of the GI map, and I quickly scanned through my YouTube catalog of all the videos I had posted on there, and I couldn't find one that was entitled GI map. So I thought, well, I'll just do an updated video, and that way I can easily just send this video to folks if they have questions about it, so it'll save time in the future. So the GI map test is a test that quite a few of my patients over the years have come in with those results. We've run it for a few patients at their request. And I think that the test, kind of break it down into pros and cons. One of the pros of the test is that they test for a number of different microbes that you generally don't see on other types of stool culture tests. So the GI map test is a PCR test, meaning that the lab is testing for fragments of DNA from the microbes in question, whether it's a virus, a parasite, a bacteria, or whatnot. They do run some other parameters too. They look at the elastase level, which is really useful. I posted some other videos about something called exocrine pancreatic insufficiency, also known as EPI, and testing elastase is something that's become quite important in my clinical practice over the last probably year and a half or so. And so it's nice that the GI map has the elastase level as a marker there. There's a couple of other markers too. They look at the steatocrit level and a couple of other things, but the bulk of the test is looking at the DNA fragments of these microbes. That's in contrast to a stool culture test, where with a stool culture test, they're actually taking a stool sample, they're plating it, so putting it on petri dishes with different growth media, and then seeing what critters grow out of those, out of that stool sample. And so they'll grow out, the lactobacilli probiotics, the bifidobacterium probiotics, the E. coli bacteria. They'll see if there's what the levels of what are referred to as commensal bacteria are at sort of normal undetectable levels or at higher levels than that. They'll test for growth of any dysbiotic bacteria. Depending on the panel that's being run, they'll test for yeast overgrowth and the different species that might come out. So the big difference between a GI map, and there's other labs that do DNA testing as well, but the GI map, which uses this PCR DNA testing, and a stool culture is really that you're looking for DNA fragments versus actually seeing what grows out of a stool sample that's been submitted to the lab. So to my understanding, the ability of a PCR test to assess for microbial presence in a stool sample, there's limitations there. And to my understanding, one of the limitations is that PCR technology has not been validated as a quantification method. So meaning it can tell you like, yes, no, is the DNA there, but on these different reports, and not just GI map, there's other labs like Doctors Data and Genova and various other labs that use DNA, like PCR testing, and many of these labs will give a quantification saying like, oh, we found like, this much DNA was replicated based on the PCR testing that was done. So they'll give a quantification number, but to my understanding, there hasn't been validation testing to confirm that the numbers that they give are actually representative of the amount of living microbes that are left in that person's body. So meaning that if, for example, say one of my patients came in with a GI map test result and they had, say, H. pylori that was high, and almost every single GI map test report I've ever seen has elevated H. pylori. And so it was telling us that, okay, they found H. pylori DNA in that patient's stool sample, but is it actually reflective of living H. pylori DNA, or is it the DNA of dead H. pylori that was, say, naturally occurring in the stomach, but it got killed off as it does through the immune system function, etc., in the gut, and then now we're just seeing the fragments of dead H. pylori DNA, or is this actually reflective of living H. pylori, and is that amount of DNA that they've amplified with the PCR technology actually proportionate to the amount of living H. pylori that's in that person's stool sample? And to my understanding, the answer is, we don't know. We don't know that it's proportionate. We can't tell from the test results whether it's living or dead microbial DNA. So if I get that, elevated H. pylori DNA, does that mean that patient has an H. pylori infection? Well, it's a good question. And in my own clinical practice, and this has been a topic that's been discussed on a number of message boards that I'm part of, like on Facebook groups and whatnot, with other naturopathic doctor-only groups or functional medicine clinician-only groups. And it's a topic that comes up all the time. It's like, hey, like my patient tested positive for H. pylori on their GI map test or an analogous DNA-based test. I don't mean to pick on GI map. I'm just trying to state what I understand as objectively as possible about this test and related tests. And so it's like, oh, my patient tested positive on the GI map test, but then they had this confirmatory test. They had a stool test using the more traditional detection method through a stool test, or they had maybe a scope that was done to in a culture to look for H. pylori in the gut, and it didn't come back positive. Yet those tests are really, really accurate. Those standard tests for H. pylori are over 90% accurate. Why did that miss it and the GI map picked it up? Well, because the patient didn't have an H. pylori infection. It was a false positive, or whatever you want to call it, with the GI map test. And so it's just an example of how we can't draw definitive conclusions about what the level of that DNA amplification means on a GI map test about H. pylori, or to my understanding about anything else that's in that report. What we can draw, and again, I don't mean to throw the PCR testing for stool samples under the bus, but what I think we can draw is that we can get a yes or no of whether or not there's evidence of this particular microbe in a person's body. So, for example, if there was a DNA that was detected of a parasite that wasn't supposed to be there, say Giardia, for example. Well, if the PCR testing picks up as evidence of Giardia, well, that's quite compelling, because you shouldn't have any Giardia in the body. It's not a natural component of our ecosystem in the gut. And so if the PCR test picks up Giardia or some other type of parasite or some type of virus that's not a natural component of that person's gut flora, then that does tell us that, okay, there's an infection. And indeed, when you actually look into the research literature, I did a fairly deep dive into the research literature on this topic, because I gave a presentation at my old naturopathic school about this a few years ago. Or I put together a presentation for this lab testing series at my old naturopathic school a few years ago. So I got knee deep in the research literature, and there is indeed validated scientific studies showing that the PCR testing can be really valuable to pick up parasite infections and things like that. Again, it's not going to quantify it, but it's a yes no. Oh, there's DNA, whether it's living or dead, doesn't matter. You got a parasite, you got the symptoms of a parasite infection. Okay, we better treat you for that parasite. So from that perspective, the testing, in my opinion, is useful if we're trying to tell, is there the presence of microbes that aren't supposed to be there in the gut, yes or no? The PCR technology can be really useful. Or another way that I believe that it's useful, in my personal opinion, and I don't believe there's any research kind of that's validated or disputed what I'm about to say, but I recently saw results from a patient that brought them in, had them done through another clinic, brought them in for me to take a look at. And there's a particular probiotic species called Akkermansia muciniphila, and that Akkermansia probiotic has been subject to quite a few research studies. It seems to be really, really important. We want this probiotic in our guts. Well, this patient, they had 0 Akkermansia DNA come up. So to my mind, that tells me that patient doesn't have any Akkermansia. That's bad. If it had come back saying, oh, there's this many billion Akkermansia or whatever the units are, well, it wouldn't tell me definitively, to my understanding, that the patient definitely has enough Akkermansia, but the fact there was no Akkermansia DNA strongly suggests that the patient probably doesn't have Akkermansia, and that's not good for the intestinal lining and overall intestinal health. So in my opinion, that was a case where that GI map was giving us some useful information. Now, unfortunately, there's no supplemental Akkermansia probiotic that you can take, so there's roundabout ways to try to maybe boost up Akkermansia. That's kind of a topic for a different day. But anyways, I'll leave it there. I'm already at 9 minutes. I'm violating social media rules here for Instagram and whatnot. Video is way too long, so I will end it there. But punchline is that there are limitations to any lab test. I think it's really important to know what those limitations are, and it's especially important in the healthcare realm, because we need to make sure that we're making as the most informed decisions that we can, making drawing accurate conclusions from the tests that we're running, so that we can give our patients the best advice that we possibly can. So with that being said, if you yourself have had great experience with the results from GI map testing or other PCR-based stool testing, or if you have heard information to the contrary of what I'm saying, post in the comment section below. This is something where I've, again, done a fairly deep dive into it. I've talked to other clinicians about it. The conclusions that I've drawn about it seem to be mirrored by some other esteemed colleagues that I have, so I feel like I'm on the right page. I've also posed some of these questions to GI map proponents. I actually contacted the GI map company when I was preparing for this lecture to see, like, hey, am I missing anything here? And to my understanding, I'm not missing anything here. So anyways, again, this is all just to my understanding, and if anybody has any contrary information, very interested to hear about it. But otherwise, I will leave it there for now.